Malaria is a serious disease. It affects millions worldwide. It is caused by a parasite. The parasite is transmitted through mosquito bites. Malaria can be life-threatening, especially if not treated promptly. Symptoms include fever, chills, and flu-like illness. Malaria is preventable and treatable. Understanding malaria is crucial. Malaria is caused by a parasite called Plasmodium. These parasites are single-celled organisms. They live and multiply in humans and mosquitoes. 5 species of Plasmodium cause malaria in humans. Plasmodium falciparum is the deadliest. It is responsible for most malaria deaths. The other species are Plasmodium vivax, Plasmodium ovale, Plasmodium malaria, and Plasmodium knowlesi. Each species can cause different symptoms. Malaria spreads through the bite of infected female Anopheles mosquitoes. These mosquitoes are known as malaria vectors. They carry the Plasmodium parasites. The transmission cycle begins when an infected mosquito bites a human. The parasite enters the bloodstream. It travels to the liver. In the liver, the parasite multiplies. It then infects red blood cells. The parasite multiplies further in these cells. When another mosquito bites an infected person, it ingests the parasites. The parasites develop and multiply in the mosquito. The cycle then repeats. Recognizing the enemy symptoms of malaria. Malaria symptoms usually appear within a few weeks after being bitten. However, some types of malaria can have a longer incubation period. Common symptoms include fever, chills, sweating, headache, muscle pain, and fatigue. Nausea, vomiting, and diarrhea can also occur. In severe cases, malaria can lead to life-threatening complications. These include cerebral malaria, severe anemia, respiratory distress, and kidney failure. Battling the infection, diagnosis, and treatment of malaria. Malaria is diagnosed through a blood test, which is the most reliable method to confirm the presence of the parasite. The test detects the presence of the parasite in the blood, allowing for accurate diagnosis and timely treatment. Several types of blood tests are available, including rapid diagnostic tests and microscopic examination of blood smears. Treatment for malaria typically involves anti-malarial medications, which are essential to eliminate the parasite from the bloodstream. The type of medication and duration of treatment depend on factors such as the species of parasite, severity of the infection, and the patient's medical history. Some medications are more effective against certain species of malaria parasites. Early diagnosis and treatment are essential for a positive outcome, as they can prevent the disease from progressing to severe stages. Shielding ourselves, prevention and control measures. Preventing mosquito bites is the most effective way to prevent malaria. By taking proactive steps, we can significantly reduce the risk of infection. Several methods can help reduce exposure to mosquitoes. These methods are simple, yet highly effective in keeping mosquitoes at bay. Using insecticide-treated bed nets, or ITNs, is one of the most effective ways to prevent malaria. These nets are treated with insecticides that kill mosquitoes on contact. ITNs provide a physical barrier and kill mosquitoes that come into contact with them. This dual action makes them an essential tool in malaria prevention. Wearing long-sleeved clothing and pants can also help reduce mosquito bites. This simple measure can be particularly effective during peak mosquito activity times. Applying insect repellent containing DEET to exposed skin can further deter mosquitoes. DEET is a powerful ingredient that provides long-lasting protection. Controlling mosquito populations is another essential aspect of malaria prevention. Community efforts to reduce mosquito numbers can have a significant impact. This can be achieved through environmental management, such as eliminating mosquito breeding sites. By removing standing water and keeping our surroundings clean, we can disrupt the mosquito life cycle and reduce their numbers.